getting blepharoplasty soon, and I'm worried about the hollowed out look I've been reading about. How common is this? I'm in my early 30s and I've had eye bags for the past 10 years. I constantly get comments on how tired I look and finally worked up the courage to get it done. However, I'm apprehensive after reading many online reviews of dissatisfied patients. How common is a sunken, hollowed out look after blepharoplasty? Does fat transfer reduce the incidence of this significantly or marginally? Does the fat transfer usually last forever, or are revisions common years down the line? Thanks.
Thank you for your question. You're in your early 30s and you've had eye bags for about 10 years, and you're planning to have surgery. And you are, of course, concerned about hollowing after looking at some reviews by people who have had not such great experiences, and you're asking about fat transfer. So this is a question that I deal with pretty much every day, because puffy bags under the eyes is one of the most common things that we take care of in our practice. And for years I have had a lot of different perspectives as to the perception of what hollowing is. You see, hollowing can be defined in many different ways, and unfortunately there's a lot of subjective aspects to this. In our practice, what we do is first explain to our patients that when you have lower eyelid blepharoplasty, where we're addressing the puffy bags under the eyes, what you want to imagine, if you could, is what the eyes would look like if the bags were not there. You see, as I mentioned in my book, The Fine Art of Looking Younger, facial aging is not just sagging, but it's also volume loss. And it has been my perception that the people who are complaining about hollowing are very often referring to not just the under eye area directly, but also to the area below the eye in the cheek area. What does that mean? Well, as we get older, we lose volume in this cheek area, the apple, what makes a younger person look younger. And so what sometimes I believe happens is that after the puffiness is addressed, a person may look at their face and say, but I still look maybe tired or hollow. And if it wasn't addressed, the discussion about what can be done afterwards, then naturally they're inclined to feel that the fat removal made them look hollow. Now, to address this hollowing issue, in addition, a lot of our colleagues, myself included, for years, have tried a variety of strategies. This includes fat transposition, fat transfer, septal tightening. And in my experience as a specialist, I have found that although much of this is conceptually and theoretically desirable, it is very often difficult to actually accomplish in practical terms. And there's basically one issue: the tissue, the quality and the integrity of the skin under the eyes is very thin, and it shows everything. So if you transpose fat under the eyes to try to fill a hollow, very often people will look bumpy. Fat transfer is something that I will do in areas where the skin is thicker. I'll place it in the cheeks, I'll place it in the nasolabial folds, I'll place it into the mandibular notch, I'll place it in the mesolabial fold, the marionette lines. But the one place I won't place it directly is the under eye area. Anywhere the skin is so thin, I have seen many patients who have come to me from all over the world who have had lumps and irregularities and scars from fat transfer. The problem is that when you do fat transfer, you're not just transferring fat, you're transferring fatty tissue. And you can go through different types of processes to, quote, purify it, but it still has been associated with variability, need for additional surgeries, as well as chronic and persistent swelling. So I think you have to have a very clear discussion with your surgeon about what to expect after the surgery and what could be done if there is an issue with relative hollowing. For example, when I examine patients and I show them that there's the puffy bags, but then they have a relative hollowing in the tear trough area, I say, well, then an option that we can have after we're done with the surgery is to consider adding filler. It's paradoxical that you have too much in one place and not enough in another, but that same is true for body contouring and other procedures. So it's about having a plan and understanding and communicating the details of the anatomy so that the person who is about to have the surgery can have a reasonable expectation of what would be the improvement. So with that understanding, I think you just need to have this conversation with your doctor. As far as reading online reviews about personal stories, I think that there is no shortage of forums and other areas on the web where people will write about their experiences, and so many of the best respected people that who I know have been both celebrated and trashed at the same time in the same forum discussion. So I think you can easily get yourself into the paralysis of analysis from just second guessing and knowing, and even though things may sound right conceptually, they may not be as practical in the real world sense. So again, meeting with your doctor and having a discussion about what the realistic impact will be of a lower lid blepharoplasty for you, I think will help you alleviate your concerns. So I hope that was helpful, and thank you for your question.